At AACR 2022, two important studies for the management of patients with lung cancer were reported. One study in resectable disease, which is CheckMate 816, a neoadjuvant study with chemotherapy plus immunotherapy. The second study is a study with sotorasib, a dedicated KRASp.G12C inhibitor that was tested in patients with metastatic non-small cell lung cancer after the failure of platinum-based chemotherapy. During the AACR meeting, I presented the results from CheckMate 816, which is a randomized trial that assessed chemotherapy plus Nivolumab in patients with resectable non-small cell lung cancer as neoadjuvant treatment. So this study compared neoadjuvant Nivolumab plus chemotherapy versus chemotherapy alone in patients with stage 1B to 3A resectable non-small cell lung cancer. This study previously demonstrated a benefit in favor of Nivolumab plus chemotherapy with regard to pathological complete response, which was 24% in those patients versus 2% with chemotherapy alone. And this translates into a benefit in terms of event-free survival. Median event-free survival in this study with Nivolumab plus chemotherapy was 30 months versus 20 months with chemotherapy alone. So this is an improvement by almost 1 year that we have in this study. And we also have a benefit in terms of overall survival. This is not statistically significant, but we have a 12% improvement at 2 years, which is clinically meaningful. In terms of safety, there was no increased toxicity or surgical complication with the addition of Nivolumab plus chemotherapy. So right now, neoadjuvant Nivolumab plus chemotherapy is a new standard of care for patients with resectable non-small cell lung cancer. We were also able to explore the relationship between pathological complete response and survival. And for the first time in this study, we were able to demonstrate the fact that pathological complete response is a surrogate marker for overall survival. During AACR 2022, we had the results from the CodeBreak 100 study, which is a study that assessed sotorasib, a dedicated KRASp.G12C inhibitor in patients with advanced refractory non-small cell lung cancer. This study was previously presented, and we had data regarding the response rate and the disease control rate, which are high in those patients. This is a 84% disease control rate and a 40% response rate in this study. So we are changing the natural history of the disease. Those patients with KRASp.G12C mutant non-small cell lung cancer may have aggressive disease. So it's very important to have for the first time a targeted therapy for those patients. At AACR, we were able to have long-term follow-up from this cohort of patients, and the 2-year overall survival was 32.5%, which is again very high, and this benefit was shown across all the subgroups, including PD-L1 subgroups, and also observed in patients with STK11 mutations, which may be associated with resistance to immune checkpoint inhibitors. So these are very important data. Sotorasib is a dedicated treatment for those patients with KRASp.G12C mutation in the setting of advanced disease. Randomized studies are ongoing and hopefully will be presented at next meetings.